evening, everyone, and welcome to today's wonderful evening. And we are going to have a 90 MCQ quiz fight. 90 questions, 12 seconds to answer each question. And let's mince about 1 to 2 points about each of the question. And the winner gets 500 rupees. So let us see who is going to be the winner. And if you want the quiz link, please, here I have typed the quiz link. Please paste it into the browser, then click enter a screen name and join the quiz. And let us see who is going to be the topper. And even if you have come late, you can participate in the quiz very much. So, doctor, let us see who is the winner for today's evening. Great, we are having 15 players, 15 wonderful players. Numbers are increasing. Come on, inform your all classmates that Dr. Murali Bharadwaz is online, ready to play the game with all of you. 90 questions, 12 seconds each. Let us see who is going to be the winner. शुरू करेंगे 3, 2, 1 start. The first question, between the tooth and its socket, what type of joint is it? So you should know different types of the joints, which is the favorite question of the examiner. Punch, punch, punch your answers, doctor. So you should remember that it is gomphosis is what you need to remember. Very good. Akhilesh is on the top, Sankeet, SP, Anju, Basha, and many more. So good to see almost 24 players rocking the show. And those who are online on the YouTube, please take the quiz link and join the quiz directly from your smartphone. So very good, doctor. Let us see the next question. Good. Question number 2. Easy question. Very easy question. Resorption of the bone is mainly the function of. So you should know, why do we get, what is the effect of parathormone on these osteoclastic cells? And what happens in multiple myeloma, osteoclast activating factor? Absolutely right, doctor. Akhilesh is rocking on the top. Now, question number 3. Which component of the placental barrier secretes the HCG is a very important question. So from where is exactly the HCG produced? So one quiz we will have single liner type, another quiz we will have a case study type, another quiz we will have image based type, etc., etc. Very good. It is the syncytial trophoblast. Question number 4. What is the nerve that supplies the teres minor is a very important question. Not the teres major, but teres minor is a very important question. Teres minor. Yes, doctor. Easy question. Very good. 13 of you are right. It is the axillary nerve. Anything about axillary nerve, you have to be very, very sure about, doctor. You need to punch very fast. Question number 5. The ligament that supports the medial longitudinal arch of the foot is, what is that ligament? Please look at your phone and punch. So you need to know what are the dynamic supports and what are the passive supports. So tibialis posterior, tibialis anterior, flexor hallucis longus, and intrinsic plantar muscles, they are all the dynamic support is what you need to remember. Very good. Basha is the hero of this question. Absolutely great. Now, question number 6. all the veins of the heart is a favorite topic. The vein which is lying in the right atrioventricular groove. Atrioventricular groove is which one? Come on. So you should be very sure. Only one person correctly answered. The small cardiac veins runs in the coronary sulcus between the right atrium and the ventricle and opens into the right aspect of the coronary sinus is what you need to remember. So that is the small cardiac vein. Oh my God, most of you have gone wrong. Only SP correctly answered. Very good. Question number 7. Oh, this is the biscuit question. All of you will correctly answer. No big deal about it. Sometimes easy questions, dead easy questions like this are mainly to make you feel happy that you are not constantly doing wrong, right? Absolutely, doctor. Absolutely. But speed is the name of the winner. Very good. It is a liver. Good. Now, question number 8. Question number 8. What are those lymph nodes which are draining the lymph from the testis? What are those lymph nodes? Testicular lymphatic drainage, uterus lymphatic drainage of the penis, all these things. Tips में रहना है डॉक्टर कल के नीट पीजी के लिए. Very good. It is the para-aortic group of lymph nodes. Whereas the lymph of the scrotum goes to inguinal lymph nodes, testis goes to para-aortic lymph nodes. भूलना नहीं, डॉक्टर मुरली भरद्वाज कल के एंट्रेंस में आपको याद आएगा. Oh, this is an easy question, baby. Aldosterone is secreted by the cells of. So a lot of times simple questions, but we will carry few confusions. So the whole purpose of entrance exam preparation is without confusions, with clarity. Absolutely. See, almost 8 people are clean board. John Glamourilosa. Only 7 of you correctly answered. Very good. Basha, SP, Anju, and Akhilesh correctly answered. Good. Question number 10. Anterior belly of the digastric develops from which pharyngeal arch? Come on, doctor. Anterior belly of the digastric. So all pharyngeal arches, what are the muscles, what is the nerve supply? Tips में रहना, अगर ये क्वेश्चन रॉन्ग करे तो serious matter है, serious matter बन जाएगा. Be very sure only 7 of you correctly answered. Such a common question. SP तो wrong कभी नहीं करेगा क्योंकि उसको मालूम है common topics को कैसे crack करना. Good to see Sankit, Meghalaya, Vaibhav, Akhil, Jada, Manisha, Chris, Rajarakunda, Harsha, Rahul, Vishal, Megha, Asha Yadav, Emigo, everybody. Thank you for joining the quiz. Spardaya, Vardhathey, Vidya. Only when we are fighting, we will enjoy. Now, skin on the lower 1/3 of the auricle. Lower 1/3 of the auricle is supplied by, very important to remember, doctor. Good. Skin on the lower 1/3 is supplied by the great auricular is what you need to basically remember. Good. So, Basha is right. Sankit, Akhilesh also are right. Question number 12. Taste sensation of the circumvallate papillae. Circumvallate papillae. It is carried by, yes, doctor. The nerve that carries from circumvallate papillae. They are more posterior, so it is the glossopharyngeal is what you need to remember. Good. Now, question number 13. What is the dangerous area of the scalp? What is that layer of the scalp which is called the dangerous area? So, skin, connective tissue, epigenosis, then loose areolar tissue, pericranium. Out of all this, the loose areolar tissue, which is called the dangerous area, is what you need to remember. Good, doctor. Good. Question number 14. Which nucleus lies underneath the facial colliculus in the floor of the fourth ventricle? Is a very, very, very important question, doctor. Underneath the facial colliculus in the floor of the fourth ventricle. Come on, let's see, doctor. Absent, sixth cranial nerve is what you need to remember. That's good. SP, unbroken, Anju, Basha. Oh, Basha did it wrong. Question number 15. Amacrine cells. Amacrine cells कहाँ होता है? ये तो बिस्किट क्वेश्चन है. ये रॉन्ग करे तो हम तो फिर जाके पूरा एनाटॉमी पढ़ना है. फटाफट फटाफट. Yes, doctor. Good. Amacrine cells are typically found in the retina, is what you need to basically remember. And one of the important functions of the amacrine cells is typically they create the functional subunits which are the receptive fields for many ganglion cells. That's what you need to remember. And they contribute to the vertical communication within the retinal layers. That is the function of the amacrine cells. If you have done wrong, this very high-end topic, you need to go back. Question number 16. The peripheral proteins attached to the integral proteins, they function almost entirely as what? So, you should know very well that enzymes are proteins. That is how they basically function. Good. Most of you have gone wrong on this imaginative question. Only Dr. KP is right. JRS is also right. Asha Yadav is right. Rahul is right. Wonderful. Wonderful, doctor. Question number 17. Poiseuille's law. Among these four options given to you, which is the Poiseuille's law. So the volume flow rate is equal to pressure difference into radius to the power of 4 divided by 8 into viscosity divided by length. Into length is what you need to remember as the Poiseuille's law. Very good. Question number 18. Which organ has the greatest amount of the blood flow for every 100 grams of tissue per minute? It's an important question. How many of you want to become a nephrologist, doctor? Nephrologist. Yay, that's right. So you should remember, it is the kidney. Only 12 of you correctly answered. That keeps SP on the top. Very good, very good. Good to see 32 players. Please tell your friends, every Saturday, Dr. Murali Bharadwaz will quiz you, and to the winner, 500 rupees cash prize is being given. Most important is you get a chance to fight with all your classmates. So AV nodal delay is how much, doctor? Wow! It is 0.1 second is what you need to remember. SP clean bulge. Akhilesh clean bulge. Good. Question number 20. 20. Abnormal color vision is 20 times more common in the men than in the women. Because most cases are caused by what? Easy question. Color vision abnormality. Yes, it is the X-linked recessive is what you need to basically remember. Good, doctor. Easy question. Question number 21. Iodine is transported into the thyroid follicles by a sodium-dependent iodide transporter. And what is that called as? Punch your answer, doctor. Incus app download karo. 999 rupees में, खाली 999 rupees में आपको मिल जाएगा 3 साल का कोचिंग प्रोग्राम, 800 hours of video, 35,000 PowerPoint slides of notes, and 60,000 multiple choice question bank, and a lot of classmates with whom you can become friends on the Incus app. You can chat with them. Later on, you can get connected personally. Everything, just 999 rupees only. So today only download, that too for 3 years. Only 1 rupee per day is the cost. Nobody in the world will ever give you that. And a lot of NEET PG toppers, NEET PG teachers, every day 1 घंटा आपके साथ बैठ के आपको stimulate करेगा रोज पढ़ने का, right? Only on Incus app. Please download and also make it popular among your classmates. Now, doctor, the next question. Question number 22. What are the vitamin K dependent clotting factors? Yay! Who is going to give me the correct answer? Good to see Manoj Singh. Sir, I love you. I do love you all, doctor. I always enjoy. This is the happiest moment of my life. Every day meeting you guys and then spending wonderful time with you. So 27910, 27910, protein C, protein S, 27910. You should not forget. Now, question number 23. 23. During normal quiet breathing, maximum work is how much? Oh, this is a tricky question. During normal quiet breathing, maximum work is it airway resistance work, compliance or elastic work? Absolutely. It is the compliance elastic work will take maximum amount of energy. Today, COVID patients, in the last moment before they are dying, they are putting YouTube videos, right? So sad to see them becoming breathless. So all the work in the normal quiet breathing goes into elastic work, compliance work. The moment lung loses compliance, the work of breathing increases. Now, the type of the nerve fibers, once more, doctor, you have to be very sure. The type of the nerve fibers most susceptible to hypoxia. So you should know, muscle spindle angulospiral ending. It is basically 1A. Isko A alpha bolte. Similarly, Golgi tendon organ is 1B. Muscle spindle flower spray ending touch and pressure is by 2. Pain and cold receptors and some touch receptors is 3. Pain, temperature and other receptors are 4. That is what you need to remember. So please don't forget, doctor, today only you should revise. Go back to the Incus learning app. In the physiology, you have the videos on the nerve fiber classification. You should do the revision. Question number 25. Yes, doctor. The muscle weakness in my myasthenia gravis. Once more, for the earlier question, please don't forget. Most susceptible to hypoxia, B type of fibers. B. Hypoxia ko B. Pressure ko A. Local anesthetics ko C is most susceptible. Please don't forget. Very good. So cholinesterase administration, anti-cholinesterase देना है. Cholinesterase नहीं, anti-cholinesterase देना है. That's right. So very good, doctor. Unbroken, Sankeet, SP, Anju, Tom, Meghalaya. They are on the leading round. Question number 26. Full development and function of seminiferous tubules required. अगर seminiferous tubules fully develop होना है, काम करना है, तो आपको क्या चाहिए is very important, doctor. Very good. It is the androgens and follicle stimulating hormone is what you need to remember. FSH and androgens are the ones which are required. Sankeet, zoom comes onto the top. Very good, Sankeet. So question number 27. Which of the following inhibits the gastrin secretion. Secretion of gastrin को prevent करने वाला कौन होता है? Come on, punch, 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 punch. So very important, because peptic ulcer disease is one of the important areas. So it is the secretin is what you need to basically remember. Now, doctor, question number 28. Prosopagnosia. Prosopagnosia is the inability to what? You call prosopagnosia is a very, very important question. I'm so happy to see 22 online, and on the app, on the quiz, we have about 34. So please inform all your friends, and also please download the Incus app and subscribe. Just for 999 rupees, you get the coaching for 3 years. Only 999 rupees, cheapest in the planet Earth. Both web and the app, दोनों का access मिलेगा आपको 999 rupees में. Very good. Unbroken is on the top of the game. Question number 29. Yes, doctor. And you should remember, prosopagnosia is because of the fusiform gyrus, is what you should remember. Now, doctor, circadian rhythm. I think most of you will correctly answer. Suprachiasmatic nucleus, all hypothalamic nuclei. You have to be 100% sure. You need to remember, doctor. Question number 30. Dehydration increases the plasma concentration of all these hormones. Except, so dehydration. So always why there is a natriuresis in SiADH? Because in SiADH there is no ADH, inappropriate ADH. All fluid is retained instead of going into urine in the plasma. Once the plasma volume increases, when you are overloaded, overvolumed, then atrial natriuretic peptide is produced, not with dehydration, right? So very good, doctor. So Sankeet, unbroken are closely fighting. Now, question number 31. The glycosamine glycan responsible for all the transparency of our cornea is because of what? Come on, punch your answer, doctor. The glycosamine glycan that is responsible for the transparency of the cornea. Good. So you should remember, Hunter's disease में cornea clear रहता, Hurler disease में cornea opaque रहता. So it is the keratin sulfate is what you need to remember. Very good. Sanket is maintaining the domination. Question number 32. 32. So the percentage of PUFA is maximum. Where is it maximum? Percentage of PUFA. Polyunsaturated fatty acids. Easy question. All of you will correctly answer. It is the sunflower oil. Sunflower oil. Very good. Question number 33. What is the earliest marker? Sabse pehla, what become elevated out of these 4 options given to you? Earliest marker of MI. Yes, doctor. Out of these 4. That please remember. Very good, easy question. So it is the CKMB, which is the marker. Question number 34. Branched chain keto acids, they become excreted in urine in which condition, doctor? Yes, easy question. Yes, very good to see 30 contesting actively. Beautiful, beautiful. Maple syrup urine disease. All these metabolic conditions you should remember, doctor. Good to see 37 online players. Wow. I want to see at least 500-600 people to compete. That is the day that should come. So please inform all your classmates. Also, every Sunday, you have a 200 MCQ full-scale grand test, which is conducted And the question paper is available on the Incus app. आज ही डाउनलोड करो और उस क्वेश्चन पेपर के ऊपर हम डिस्कशन करेंगे एवरी संडे. एवरीथिंग इन द सेम 999 रुपीज फॉर 3 years पैकेज में ही आपको सब कुछ दुनिया में मिल जाएगा नीट पीजी के लिए. There is no need of paying the 40,000, 50,000 plan A, plan B, that plan, topper plan, all that bakwas hai. There is only one plan, Incus learning app. आम आदमी का कॉमन 1 रुपये में नीट पीजी को प्रिपरेशन करना है, क्योंकि ज्यादा पैसा पे करके बड़े बड़े कोचिंग सेंटर्स को गए तो सीट आएगा बोल के कुछ भी नहीं है, वो सब पर्पस है. The purpose of a coaching or any video app is to stimulate you. You have to read yourself and reproduce in the exam. Now, doctor, question number 35. The enzyme which is required for the degradation of the glycogen, and why only the liver contributes to the blood glucose, liver glycogen, but not muscle. Muscle का glycogen blood glucose को contribute करेगा नहीं, because it is the phosphorylase which is required to degrade the glycogen is what you need to basically remember. Now, question number 36. The neurotransmitter from the decarboxylation of the glutamic acid is on which all your benzodiazepines, barbiturates, everything are working on. Come on, punch your answer, doctor. Very good. It is GABA is what you need to remember. Now, question number 37. Gaucher's disease. All these biochemical metabolic disorders, what is the enzyme deficient? You have to have that list, doctor, that the Sandhoff disease is hexosaminidase. Similarly, metachromatic leukodystrophy, aryl sulfatase. Krabbe's is galactosyl ceramidase. Fabry, alpha galactosidase. Gaucher, beta galactosidase. Niemann-Pick, sphingomyelinase. And Farber, ceramidase. Woolman's, acid lipase. And Austin, multiple sulfatases. Exam tak batti maar ke yaad rakhna. There is no other option. Good to see 37 players. Very good, doctor. Now, question number 38. Nitric oxide. From where is nitric oxide is formed? What is the source of nitric oxide? Yes, punctual answer, doctor. From where is the nitric oxide is basically formed? So you should know amino acid metabolism. What is the importance? How the metabolic, what are the metabolic end products? It's the arginine is what you need to remember. Question number 39. भैया ये तो एकदम बट्टे मारने वाला आइटम है. You should know which complex is inhibited by what? Cyanide, carbon monoxide, hydrogen sulfide, azide. They all inhibit 4, complex 4. Whereas malonate inhibits complex 2. Emobarbital, rotenone, they all inhibit the complex 1. That is what you have to emphatically remember for the tomorrow's NEET. Very good, doctor. Question number 40. Come on, inform your classmates. Please share this YouTube channel, youtube.com/onlinembbs with all your friends. The mineral which is important for the taste sensation, which is lost in COVID. And in the COVID, we give this mineral. What is that? Zinc. Acrodermatitis enteropathica is what you need to remember. Question number 41. For the intrinsic factor absorption, oh, this is a biscuit question, just to make you happy. Okay? All tough questions is not good for health. Easy question, all of you should correctly answer. Yes. So, intrinsic factor for absorption. So it is the cobalamin which is important, which is what you need to remember. Now, the 42. Respiratory acidosis. Where do you see respiratory acidosis out of all this? Respiratory acidosis. So whenever there is a ventilatory failure, then you get respiratory acidosis. Hyperventilation lead to respiratory alkalosis. All of you know very well. Vomiting lead to metabolic alkalosis. And lactic acidosis lead to metabolic acidosis. Whatever. 10 of you correctly answered. Acid-based disturbances. Pakka, Garma, Garam, Raina, Doctor. Question number 43. Urea is by the action of which enzyme? Ultimately, urea is released. It is the action of which enzyme? Urea is produced. A sub urea cycle में आता है, मगर urea is released by the action of. Yes, doctor. Urea arginase. Arginase is the one which ultimately causes the release of the urea. So typically, you need to remember L-arginine is divided into urea and ornithine by the action of arginase, and typically it is a cytosolic enzyme. Arginase, arginosuccinase, and arginosuccinate synthetase, they're all basically cytosolic. All the remaining enzymes are all mitochondrial. Like ornithine, transcarbamylase, carbamyl, phosphate synthetase 1, they're all mitochondrial. Be very sure on the urea cycle, doctor. Urea cycle को अगर अपमान हो गया तो वो आपको क्षमा नहीं करेगा. Very good. SP is once more on the top. Question number 44. The electrolytes like sodium, potassium, how do you measure them, doctor? How do you measure them? Is it flame photometer, spectrophotometer, radioimmunoassay? How do you measure sodium, potassium? This is a bit tricky question. Only 2 of you right. Flame photometer is what you need to remember. All the top guys, SP, Sankit, Tom, Anju, everyone is gone. Question number 45. So, Cockcroft Gault formula. 140 minus age into weight in kgs divided by serum creatinine milligram per deciliter into 72 into 0.85 if it is a female. What is that? It's a creatinine clearance for the renal function. You have to be very sure on this important formula. Wow, very good to see 39 online players. I want that number to go to 500, 600 every day evening when we play. Remember, every Saturday evening we will have one quiz tournament, right? And the winner gets 500 rupees cash prize. Now, these are all the possible uses of enzyme induction, except. Yes, doctor. Enzyme induction. Very good. So, it is the so SP is on the top, question number 47, which is not a teratogenic drug. Which is not a teratogenic. Always, you should make a list of all the teratogenic drugs, doctor, very sure. Be very sure. Easy question, this one. If you answered this wrong, you are missing the table. You have to make the table. Yes. Good. Penicillin, doctor. Penicillin is very safe in pregnancy, not teratogenic. Question number 48. Prolonged use of oral contraceptives से कुछ problems आएगा. So all these are those problems except with the prolonged use of the oral contraceptive, combined oral contraceptive. Good. So thromboembolism, hypertension, genital carcinoma, etc., etc. Whoa! 39 players. Shortly we are going to cross 50 number before the quiz is over. Question number 49. What are the various routes childhood vaccines are administered? Childhood vaccines. Easy question. Shortly, COVID also, they are going to make children to receive the vaccination exuberantly. Good. Great, doctor. Nobody will give intravenous vaccination, right? So, SP, Sankit, Anju have correctly answered. Question number 50. Come on, doctor. All are the examples of the hit and run. Hit and run. Ramakrishna Lingari, Rajkumar, Manoj. See, you have the quiz link, doctor. You can always participate from the quiz link. So please don't forget. And please be part of our Incus app and the WhatsApp study group, right? So that's good. Now, doctor, the next question. Question number 51. 51. Guanifacin is what? What is the function of guanifacin? So you have mucokinetics, mucolytics. Ambroxyl, acetylcysteine, bromohexane, they're all mucolytics. Whereas the sodium potassium citrate, guanifacin, they're all mucokinetics, which are the bronchial secretion enhancers, is what you need to remember. Now, question number 52. These are all effective in treating Paget's. In the Paget's disease treatment, we use all these things except. So, Paget's is one favorite topic, right? So, biphosphonates, calcitonin, plicomycin, all of them are used, but not sodium EDTA. Good, Sankit is on the top. So let us see. One question idhar udhar. Positions ऊपर नीचे हो जाएगा. 500 rupees topper. Let us see who is going to be. Mifepristone. What is mifepristone? Is a very, very important question, doctor. Mifepristone. So you should remember, mifepristone is a anti-progestin, as all of you know very well. Now, the drug which is an inhibitor of the renin synthesis, which inhibits the conversion of angiotensinogen to angiotensin, is which one? So, all these quiz questions, explanations, everything is available on the Incus app. We are creating something called 70,000 NEET PG question bank as flashcards. They are available like decks. You can go through the flashcards, bookmark those questions which you wanted to revise in the last moment. That's how we are going to give you. Once more, everything in that 999 rupees only, not a single rupee more. Barabar? So, if we give love, we want to give love, full love. No anything conditional love nahi hai, right? So please download the Incus app, subscribe today only, and enjoy your preparation for just 1 rupee per day. So, doctor, it is Ellis Kiran is what you need to remember. Very good to see Sankit on the top. Let us see. Question number 55. 55. These are all uterine stimulants, except which does not stimulate uterus. Very easy question, right? So, always single liners are more challenging than the case study based, but so max sulfate is not. Very good. Question number 56. Gileuton. What is gileuton? Oh, this is also a biscuit question. If you have done this question wrong, I'll give you free coaching, doctor. Come on, push your answer. Gileuton. O is lipo or leuco. It is a leukotriene synthesis inhibitor, as all of you know very well. Question number 57. Linezolate. So, what is the class of agents linezolate belong to? So, there are 3 newer classes, doctor. Cyclic lipopeptides, daptomycin. Then glycyl cyclins, which is tigecycline. And oxazolidinediones, which are the linezolate, which is bactericidal against the gram-positive, including MRSA, and also vancomycin-resistant strains also. Now, doctor. So after the session is over, immediately go back to the Incus quiz. In that, you have the video library, pharmacology. In that line solid के बारे में एक गर्मा गर्म वीडियो है, revision करो. Question number 58. Insulin preparation, which is used for intravenous administration. अगर ये question आप wrong करें तो doctor, I will correct. You should not do wrong. उतना simple question है. Oh, only 9 of you are right. Regular insulin, doctor, diabetic ketoacidosis में IV insulin क्या देते हैं? Regular insulin को देते हैं. Insulins, oral hypoglycemic agents. Today only you go back to the Incus app, video library in pharmacology में insulin का गर्मा गर्म revision करो. Good, doctor. Sankir clean bowl. Oh my God, I'm surprised. SP, unbroken, Anju, Akhilesh. Question number 59. Which is not a proton pump inhibitor? Oh, this is a biscuit question. Easy question. Yeah. So, ornidazole is a drug that you use to cure the protozoan infections, and it is also used in Crohn's, etc., etc. So, doctor, question number 60. Question number 60. The lowest concentration of an antimicrobial that prevents the visible growth of the bacteria. इसको क्या बोलते हैं, doctor? Easy question. Come on, punch. Lowest concentration of the antimicrobial. Very good. It's called minimum inhibitory concentration, as all of you know very well. Good. That keeps Sankit on the top, closely followed by SP. Let us see. What are the contraindications of ketamine and what are the special indications of ketamine? Doctor, ketamine, halothane, isoflurane, there are totally not more than 15 to 20 drugs in anesthesia. 10 points आपके मुट्ठी में रहना. So in hypovolemic shock, in fact, you will give ketamine because of its vasoconstricting property and ability is what you need to remember. Question number 62. The following drugs needs to measure the plasma concentration in order to correlate with the clinical effects, except. So which drug is needed to measure the, which drug needs plasma measurement? Yes, we don't do it for heparin. Oh, easy question. So you should know what is the therapeutic index. Question number 63. So all these antipsychotics, their side effects, everything you should remember, doctor. Most of the antipsychotics, they have an anticholinergic effects, but Giprasidone has no activity on any muscarinic acetylcholine receptors and lacks any anticholinergic effects is what you need to remember. So only Sankirt correctly answered. SP, Tom, Unbroken, Anju, Akhilesh, Meghalaya, Basha, everything clean board. Akhil, Anil, Vishal correctly answered. Very good, doctor. Question number 64. Megolgrate is used as what? Megolgrate is hydroxy magnesium aluminate complex that is rapidly converted to magnesium hydroxide and aluminum hydroxide, which are absorbed poorly. So that is the reason they are used as for their antacid effect is what you need to remember. Very good. Sankit, SP, Tom, Unbroken correctly answered. Question number 65. Which receptors were blocked by the Losartan? Oh my God. In entrance exam, these are the nail-biting questions. We know angiotensin, but which angiotensin? Which angiotensin is the question? Whoa! It is the angiotensin 1. Only 5 of you correctly answered. Sankit clean ball. SP correctly answered. Very good. One more wrong by Sankit. SP will take over back his crown. Wound contraction is mediated by. So how is wound contraction mediated? Yes. Punch your answers, doc. Wound contraction is mediated by. Very good to see Deepak Sharma, Chaitanya, and many more who are all online. Even if you are late, don't worry, doctor. You have that quiz link. Upar hai na, to join, go to ahaslides.com. Or link ko jana, or you can participate even now also. No worries, right? But please remember, every Saturday evening, हमको Dr. Murali Bharadwaz के साथ एक गर्मागरम fight होगा, pan India level quiz, right? Good. Question number 67. Please inform all your classmates. 1 week we will have case study based questions. Another week we will have image based questions. Finally, we will spice up the preparation, right? Now, growth promoting marker of the oncogenesis is what? So, RAS is typically, they belong to the family of small GTPase, and they're involved in transporting signals within the cells. So, cellular signal induction, that is what they basically do. Very good. So, most of you are wrong. This is very molecular level question. Unbroken only is right. Question number 68. And RAS point mutations are the single most common abnormality of the human proto-oncogenes, is what you need to remember. So the beta pleated sheet, if you want to see, how will you see? We see with X-ray crystallography is what you need to remember. Easy question. Question number 69. Speckled pattern of immunofluorescence. Where do you see? Oh my God. All these rheumatological conditions and the serological markers. Very important question. So it is the anti-Smith antibody. Sankit, SP, unbroken are all clean ball. Question number 70. 70. So BRCA1 gene, where is it located, doctor? On which chromosome? Is it, what is that chromosome where BRCA1 gene is located? Pranay San Givargis. Very good, very good, very good. So, doctor, very happy to see 24 online players. Even now, you can go to the link which is being given about doctor, and you can participate. You can tell all your friends that every Saturday, Dr. Murali Bharadwaz, 500 rupees to the winner, right? So don't forget to participate. I want to see about 500-600 students participating. So every day evening, 1 hour, either NEET PG Topper के साथ चाय पे चर्चा, नहीं तो एक clinical minute based questions का discussion, कुछ ना कुछ मसाला प्रोग्राम चलाएंगे, रोज शाम को 1 घंटा मिलके पढ़ाई करेंगे, right? So please don't forget, subscribe to this channel and also share it among your classmates in the WhatsApp group. So congenital syphilis, as all of you know, easy question. Question number 72. Non-caseating granuloma with acid-fast bacilli in the macrophages. Wow, this is a beautiful question, doctor. Acid-fast bacilli, AFBs in the macrophage, but it is not caseating. Wow, it is leprosy. Leprosy. Sarcoidosis is non-caseating granuloma, but why do you see acid-fast bacilli? You don't see. It is a non-caseating granuloma. That is there. It is a granuloma, right? Sarcoidosis is the most common wrong answer. Oh no, Sankit is clean bolt. Question number 73. Kaposi. Oh, which human herpes virus, doctor? I know. most of you will correctly answer. Human herpes virus. Human herpes virus. Come on, punch your answer, doctor. Yes, it is the human herpes virus 8. 8 is what you need to remember. Very good. Sankirti is on the top, unbroken SP. Very good. Question number 74. Please punch your answer, doctor. One arm is lost and the remaining arm is duplicated. What is the structural abnormality of the chromosome called as? Come on, punch your answers, doctor. Khalil, Bhaiya, Pranoy, and many more who are all online. Thank you for joining this wonderful evening with Dr. Murali Bharadwaz, the most unemployed MD General Medicine. Jisko teaching is like an inborn error of metabolism. I'll be spending time with you. Sankirti is on the top with 4,000 points. Question number 75. Subepithelial cambium layer is seen in which tumor? In which tumor of the bone? Yes, doctor. Subepithelial cambium layer of stromal cells. So typically it is seen in angiomyolipoma with epithelial cysts, a little scratchy question. Very difficult for many to answer, but unbroken could answer it. Yeah, because he's unbroken. So, next question, doctor. 30-year-old lady, asymptomatic, not requiring blood transfusion, was found to have 13 hemoglobin, HB of 95, A2 is 2.5%. What is your diagnosis? What's your diagnosis? Very good. It is the hereditary persistence of the fetal hemoglobin is what you need to remember. Question number 77. 77. Obstruction of 2 or more major hepatic veins. Where do you see that? Hepatic vein obstruction. Yesterday only we discussed it with Dr. Dairya, this particular question. Come on, punch your answer. Obstruction of 2 or more hepatic veins. Very good. It is Budd-Chiari syndrome is what you need to remember. Wow, there we see 40 players fighting. Sankirti is on the top. Unbroken, SP, Akhilesh, Tom, Anju, Meghalaya, Basha, Misbah, Vishal, Vishwa, Harsha, Kamali, Yogesh, Karan Murmu, Chaitanya, Rajakonda, Manisha, Kaleen Bhaiya, Aishwarya. Wow, doctor, I'm so happy. I'm so happy. And question number 78. Destruction of the fat in acute pancreatitis. How does it basically happen? So what is that? Enzyme which is involved is a very, very important question. Good. So, doctor, very good. It is the lipase and trypsin is what you need to remember. Sankit, unbroken SP. Akhilesh. Very good. Question number 79. 79. Undifferentiated malignant tumor is showing cytokeratin positivity. So, what is it most likely to be? So, you must be very sure. Vimentin, etc., etc. What are the important markers? Carcinomas show cytokeratin positivity. Oh, very simple, easy question. Sankit, SP are right. Question number 80. Last 10 questions are going to decide a lot of things. Oh, easy question. Everyone will answer this correctly. But still, just to make you happy that because constantly failing is unacceptable, right? So, autosplenectomy. Wow, that sickle cell anemia is what you need to remember. Very good. Sankit, unbroken, and SP. Question number 81. 81. Albuminocytologic dissociation with acute flaccid paralysis, symmetrical, where do you find? So many times we discussed yesterday. Please follow the video of Dr. Dhairya, excellent teacher in general medicine. So we discussed Gulen-Barre. Absolutely, doctor. Absolutely. Good to see Sankeet, Unbroken SP, Akhilesh, Tom and Anju. And you have another very good teacher, Dr. Varun Soni, in surgery, who is doing MS General Surgery, final year. And we have Dr. Ganesh Ram, who is a recent NEET PG topper doing orthopedics. They're all wonderful NEET PG toppers. At the same time, they are the good teachers. One day, you also should come to the platform and become a teacher for the next generation of the NEET PG aspirants. Munro's micro abscess. Where do you see that? We see it in the case of the psoriasis. Easy question. Question number 83. 83. All these tubers show Samoma bodies. Yesterday only I gave you a mnemonic for remembering. Except, come on. Is it papillary or is it serous? Is it papillary or is it serous? Where do you see? Come on. Wow. Not in hepatocellular carcinoma. Easy question. Sanket is on the top. Last 6 questions. Medulloblastoma. Where does it happen exclusively? Kaha milta hai aapko medulloblastoma? Exclusively. Easy question. Yes, doctor. Yay, that is cerebellum. Is what you need to remember. It is 10 points about all these hot topics for NEET PG. You should remember, doctor. So basically, when you participate in a quiz, within 10 seconds, you have to punch the answer. That will give you the real decision-making speed. That is what is required in entrance. So examiner will give you 1 minute to answer, but you should be ready to answer in 10 seconds. So Kimelstein-Wilson's lesion, easy question. Everyone will answer. Yes, doctor. Great. In the case of the diabetic nephropathy is what you need to remember. Sanket, Unbroken SP and Akhilesh. Question number 86. Last 4 questions before we know who is the topper. Who is the topper? L and H variants of Reed-Steinberg cells. Where are they positive? Where are they positive? Come on. What are they positive? So you should be very sure. Classical Hodgkin's lymphoma. Typically, you have mummified Reed-Steinberg cells. Then popcorn cells, they are the lymphohistiocytic variant of the Reed-Steinberg cell, is what you need to remember. So you should know about these markers very clearly. Now, the last 4 questions. Let us see who is the winner. Which ovarian tumor is of surface epithelial origin? You should know all the ovarian tumors, classification, anything, everything about each of the ovarian histological type. You should know 5-6 points. Patti marna padega. Download Incus app, 70,000 question bank in the form of flashcards. We are introducing that new feature on the Incus app for the same 999 rupees subscription. Tonight we are going to upload the next version of the Incus app. You can nicely play 70,000 questions with explanatory answers. If you are doubtful, right, you can bookmark them, and last moment you can do the revision. You have the full explanation for every question. So आपके साथी के साथ बैठो, फटाफट 70,000 questions को खेलते आगे बढ़ना फ्लैश कार्ड्स में. All this available for just 999 rupees, along with 2000 HD videos of 800 hours duration on the Incus app. Nowhere in the world you will get the knowledge so cheap, so easy, so assimiable, and so playfully learning. That is Dr. Murali Bharadwaz and Incus app. So please download the Incus app today, doctor. So surface epithelial origin. Now let us see, doctor. Question number 88, last 3 questions. Polyp, highest risk of malignant transformation कहाँ होता है? Come on, come on, come on. Punch, punch, punch. Punch your answer. Yes, doctor. Polyp with highest risk of malignant transformation. Yay! That is villus adenoma is what you need to remember. Sankeet is maintaining domination, closely followed by Unbroken, followed by SP, followed by Akhilesh. Akhilesh is one of our favorite toppers recently. He got 500 rupees cash prize. So you also should win the cash prize. More than winning the first prize, participation is more important, doctor. Whether it is love, romance, or war, or NEET PG preparation. Better late than never. Participation is more important. To be in the game is more important. To keep fighting is most important. And automatically everybody become a winner. Be very sure about it. Doctor, the last 2 questions, let us see. On the histopathologic examination of the liver, in case of malaria, what is the important finding, doctor? Malaria में liver में क्या होता है? Come on, punch your answer. Great. Kupffer cell hyperplasia, periportal infiltration of the pigment-laden macrophages is what you find. Whoa, Sankeet lost the question. So Sankeet, 4,886 points. Unbroken, 4,777 points. SP, the unconquerable king in the last 2 quiz tournaments, he won the 500 rupees cash prize. Followed by Akhilesh, Tom, Anju. Let us see who is going to be the winner of this today's wonderful evening with Dr. Murali Bharadwaz. Question number 90. Let's see. The metabolite. Oh, this is an easy question. Itna easy question, 98 question nahi hona. So the 98 question, garma garam masala hona. Come on, punch, 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 punch. Yay, that's right, doctor. Finally, who is the winner? Yay! Let us see. Please give a standing applause. Sankeet. Sankeet is the winner of the today's evening with 4,974 points in this marathon, adrenaline pumping NEET PG quiz with Dr. Murali Bharadwaz. Thank you so much for all of you who participated. Unbroken, SP, Akhilesh, Tom, Anju, Kim, Meghalaya, Akhil, Vishwa, Misbah, Vishal, Amito, Harsha, Karan Murmu, Avanti, Asha Yadav, Chaitanya, Kalim Bhaiya, Rachakunda, Vaibhav, Manisha, and everybody who joined this wonderful evening, doctor. So, बहुत मजा आ गई. So I want to tell you, download the Incus app. 800 hours of 2000 HD videos and new videos are added every day, right? And Incus is the only place where recent NEET PG toppers become teachers and teach you. And we gamify the learning. You have 20 questions as a quiz tournament and you can play. And you have 70,000 question bank as a flashcards. Look at the question, click, you get the explanatory answer, then bookmark if you want to remember last moment and do a revision along with your friend. Everything on the Incus app. Today only download, call our helpline number, 999 rupees. You get 3-year subscription. Just if you go to a movie with your boyfriend or girlfriend, it is much cheaper than even going to a movie. But ultimately helps you to become the topper in the NEET PG exam. So thank you very much, doctor. Good forward.